Good evening and welcome to the VA Long Beach Virtual Veteran Town Hall. My name is Alyssa Rivas, VA Long Beach Healthcare System Deputy Public Affairs Officer and Air Force veteran myself. Thank you for joining our live, hour-long telephone town hall. We've got some great information to share with you. We'll hear from our Medical Center Director, Mr. Walt Danneberg, and other services about some important updates, and of course, we'll be taking questions during our Q&A session. We'll get to as many questions as we can within the time allotted, and we'll route any unanswered questions appropriately for follow-up. If you've got a question about your personal healthcare situation, please reach out on My Healthy Vet, where you can contact your care team. If you're joining this town hall from your cell phone and you want to join and view the live stream, simply press *8 on your keypad to receive a text with a link to view the streaming player. You can also visit access.live/VA Long Beach VTH, that's Victor Tango Hotel, and you'll be able to tune into the event. We'll be live streaming on Facebook, so you can catch us there as well. And if you want to share this number with your friends and get them on this call too, you can call in at 833-380-0695. This is an interactive forum, and we would love to hear from you. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They'll take down your name and your question. If you're streaming the event on our website, you can simply type your name and question below the streaming player. Be sure to not share any personally identifiable information or protected health information. If you'd like for our team to follow up with you for a personal issue, notify our staff when you're in the queue and verify your phone number. We'll follow up with you within a week. Please keep in mind, we'll only be taking questions on this platform. If you post questions on Facebook, we'll follow up with those after this event, but please do not share personal information on Facebook, as it is an open page and anyone can see what you post in the comments. We'll be posting information shared here on our social media and in our weekly email update. So before we get started, please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, and at this point, I will go ahead and turn it over to our Medical Center Director, Mr. Walt Danneberg. Sir?
All right, well, thank you very much, Alyssa, and thank you to all of our veterans and family members and stakeholders who are joining our town hall for January 7th of 2026, and I can't believe it's already 2026, and I hope all of you were able to enjoy the holiday season and spend some well-deserved times with loved ones. And I know the holidays are not always positive and can sometimes be challenging and bring on stressors. And for those of you who are stressing and may know someone who is, I always like to offer the 988 as a resource for a veterans crisis line. So you dial 9888 and then press 1. And so it may not be for you, maybe for someone you know and love and care about. And that is a resource that is available 24/7 for anyone who may be experiencing difficulties related to the holidays or not always there for you. And speaking of 2026, a lot of great things are happening across the nation, and 2026, not only for the VA but for our country, will be our 250th anniversary. And it does not go unnoticed and unrecognized that the 250 years of this incredible nation is not possible without the sacrifices that our men and women who wore our country's uniform put forward so that we can enjoy the freedoms and the liberties that we enjoy every single day. So thank you to our veterans, and we are here 100% to serve you and to be there for you. 2026 also marks the 80th anniversary of the Veterans Health Administration, so it is a monumental year for VA and for our country. And speaking of national updates, you're probably already familiar with VA Secretary Doug Collins, but just last month, the Undersecretary for Health, the Honorable John Bartram, was confirmed by the United States Senate, and just this week he was sworn into office. So looking forward to hearing more on his vision and direction for the Veterans Health Administration. He's already made it known that We are putting veterans first, same as Secretary Doug Collins, and focusing on safety and the quality of care that we deliver, and also being very upfront about mental health care and spiritual care is health care. So really looking forward to continuing under his leadership. Also, you may have seen in the news over the course of the past several months information or news stories related to restructuring of the federal government, and that also impacts the Veterans Health Administration. And I had the opportunity to travel to Washington, D.C. just a few weeks ago to learn more about the restructuring efforts around the Veterans Health Administration. And the focus, again, is keeping our veterans first and enhancing veteran care, also enhancing the operational consistency, and ensuring that we have market-level agility to provide and implement and leverage advancements in healthcare technology, and then also leveraging regional and local needs of our veterans populations and to be more responsive to our veteran needs. In addition to that, we have a great agenda scheduled for you today, so we'll move forward here in a few moments and we'll hear from Mr. Anthony Strelitz, our Chief Engineer, with some construction updates. And again, we are continuing to build a state-of-the-art facility and campus here at the T4 Rubin Medical Center and throughout our community-based outpatient clinics. And then we also have some updates with regards to our mental health care services. And then we'll move forward to Dr. Audrey Martinez to provide some updates with regards to suicide prevention. And then we'll head over back to Ms. Alyssa Rivas to share some announcements. And then one of our favorite parts is heading to the Q&A session. So we have just a few special presentations, and then we'll open it up to our veterans and our community stakeholders to ask questions. And we will do our best to answer live on the spot. And if we don't know the answer, we will do our best to find the answer and follow up with you to ensure that your answers or your questions are indeed answered. So with that, I'll go ahead and turn it over to our first presenter, which is Mr. Anthony Strelitz, our Chief Engineer, to share some of the great work that he and his team are doing to, again, bring state-of-the-art facilities to you.
All right. Thank you, Mr. Dannenberg. Appreciate the introduction. And to the veterans out there, I'm also a veteran of 20 years and look forward to improvements to our facility. And I'm going to go over a few of the projects. We have a lot of projects, over $400 million worth of different projects in various stages, and this is just a highlight of those. I'm going to highlight the large ones, particularly ones that are going to have big impacts to our facility. The first one up is our Community Living Center. We are planning on receiving our new center in summer of 2026 for first patient day. The plan is June 26th of 2026. This will bring state-of-the-art facilities. It'll provide individual rooms for the residents. We have 120 rooms, plus all the support and ancillary facilities to be able to provide a home-like environment, as well as all the capabilities to provide all the medical services necessary for those veterans. So this is a great new facility, and it's almost here, and it's been a long time coming, but it's going to be a great facility. Part of the larger construction projects going on the campus, we understand that there is a huge issue with parking, and we are on the horizon of receiving our new parking garage. We are looking to receive that in mid-summer, and it's going to bring to us 500 approximately new spaces to the campus. But what also it will bring is an extra 110 spaces of an ancillary parking lot that's currently being used as a staging area. So overall, it's going to bring 650 extra spaces to this facility. So that's coming in the summer. It's going to be in keeping with the integrity of the campus, and it also provides some state-of-the-art sustainment, which will provide photovoltaic cells as well as handicap parking and services like that. The next is part of that reception of the parking garage will provide the ability for this campus to lessen the constraints of parking, and with that, we're going to also reduce some of the restrictions around the road. We have some one-way areas as well as some parking areas that are temporarily being used and are going to be returned to their original configuration, and it'll provide better flow around the campus, as well as providing better aesthetics, and that'll also help the organization. But we have a clear plan here, the graph showing a staged and phased process that we will look at very closely to match to the needs of the facility. So towards the end, if we still are feeling some constraints, we won't follow through on all the returning of some of the areas so we can maintain the proper level of parking for our veterans. And then with all the new construction, that frees basically the old buildings that were on campus, which were not meeting the seismic requirements. We will be planning the demolition of those buildings. As I said, the new CLC will be moving in June, so that will complete the vacating of buildings 128 and 133. And with that, we'll be planning in 2027 to be demolishing those buildings and returning that area in preparation for future projects that we plan to bring to this facility. Also part of that, what some of the other supporting impact projects that we're doing here at the facility are to supplement things. In this particular case, part of the demolition of Building 133 also includes Building 136, which is the Peer Center, and we're just finishing up and we'll be completing the renovation of Building 46 North, which will provide the new Peer Center for the facility. So we're forethinking in making sure that we have all the functionalities for our patients in modern state-of-the-art facilities, and in this case, we're going to be providing the same functions of the current pier, but with updated things like cooking areas, showers, and other things that support the Peer Center. So we're looking forward to that happening. And lastly, with all the many different projects that we're doing here at the campus, we're also preparing for our future. We will be making updates to our imaging service, and part of that are some projects to move some of the facility, the functions around. In this particular case, we call it the Radiology Impact Project, where we'll be moving our ultrasound and dexometer, bone densometer system to Building 2, and we'll be starting that work this coming the end of January. And what that'll be doing is freeing up space so that we eventually can renovate the northern area of the current imaging service area. So these are many of the different projects that we're doing, and there's a multitude of others that if needed, we can, well, if people would like, we can provide information on those. And if you go to our homepage, there's a link to construction projects, which will provide all the other different projects that we're doing here at campus. So thank you for your time, and we look forward to the future configuration and improvements to our facility, and have a great new year. Thank you.
Fantastic. Thank you for those informative updates. Always a lot going on here at VA Long Beach, that is for sure. So we do want to give you a quick reminder that if you've got a question, you can press *3 on your keypad at any time to get into the queue for our Q&A session. Or if you're watching our live stream, you can type your question under the streaming player. All right, and now we will hear some updates from mental health from Dr. Veronica Pallid.
Hello. So for our mental health updates, we are now in our new mental health building. It's a great segue to new construction because this has been an amazing construction that we've had so far. So for our outpatient, if you are looking for that building from our 128 building, we are now on 600. And there is located our behavioral health interdisciplinary program, our outpatient program, our women's mental health program, as well as our addictions and recovery treatment program, our PTSD clinic, neuromodulation, suicide prevention, neuropsychology, mental health PAC team, and our intensive community mental health recovery. And then across it is our building 800, and that's where our inpatient programs are, our mental health acute and mental health GERI, as well as our UMHC. So a few things to remember. We have our same-day access for our primary care mental health integration if you're needing that support or that programming. and our urgent mental health clinic in Building 800, you can always walk in there. Our new peer center, as was announced, is going to be in progress, and hopefully sometime this coming year is when we move. And one more place is our Cabrillo Clinic. This is where our intensive outpatient programs are, both for our Pathways for Recovery Center as well as our IOP clinic for our addictions and recovery treatment program. A few new things that is going on. Our women's mental health specialty mental health program is integrated in our BHIP program now, so we're hoping that that would make it less or easier for folks to get services quicker for our women veterans, as well as it's also spread out to our ART program, our Addictions and Recovery Treatment Program. That means that if you are a woman veteran looking for treatment in addictions, we have a specialty provider for you. And we are also providing both group therapy and individual therapy now in our ART program. So we have a lot of great things that we're expanding in our different programs.
Awesome. Also, some great information. I really appreciate you coming and sharing all of that. So we'll go ahead and hear from Dr. Audrey Martinez next for the Suicide Prevention Program updates.
Hello, thank you for the introduction. Again, I'm Dr. Audrey Martinez, and I work in our suicide prevention program here at Long Beach VA, and I just wanted to talk a little bit about what that program is. So when veterans are identified as being high risk for suicide by clinical staff across the hospital, they can be referred to our program, and we provide intensive case management services for veterans. What that means is that we are able to assign a case manager and help veterans get connected with care. We provide frequent telephone check-ins to assess suicidal ideation, and we engage in frequent safety planning to reinforce use of healthy and effective skills. We also work with the Veterans Crisis Line. So when veterans contact Veterans Crisis Line, they speak with a trained responder, and they have the option of having that call transferred to Long Beach VA or other VA facilities. Us in suicide prevention will then receive that call and then call the veteran back to kind of check in to see how the veteran's doing and what needs may still need to be addressed. So we can help you definitely with care coordination. We also provide community outreach, so we go out into the community and we provide education and promotional materials to help really get out the message to call 988 if you're in distress. We have VA SAVE trainings that we provide to the community to help individuals, veterans, family members, community better understand suicidal ideation, how to ask tough questions, and then what to do with that. So that's a really helpful and healthy training that we can provide to the community. We provide gun locks. So we distribute gun locks both at outreach and upon request. So anything that we can do to put time and space between a veteran and their suicidal crises is increasing the chance of a veteran coming out of that crisis healthy and well. And we also do work with our clinical staff to help increase knowledge about suicide prevention processes. I wanted to touch a little bit on the Veterans Crisis Line. Again, this is a very helpful line to call. So it's been downsized from a really long, cumbersome number to 988. So kind of like you have 911 for medical emergencies, there's 988 for mental health crises. It's available 24/7. Civilians can call, veterans can call and press 1 to speak to a responder. And again, you can always request to speak to suicide prevention if you wanted to. So again, 988 anytime you're in distress, 24/7. And then finally, I just wanted to review some of the emergency or urgent crisis lines here at Long Beach VA. For life-threatening emergencies, just a good reminder to please call 911 or go to your local emergency department. If Long Beach VA is your closest emergency department, please come by Building 164, and emergency services are available 24/7. For urgent mental health issues that you may not have a medical appointment for, you can drop by the Urgent Mental Health Clinic, UMHC, located now in Building 800, room 1200. It's open Monday through Friday, so you don't need an appointment to speak to a medical provider. Open 7 a.m. to 5 p.m. Thank you so much.
Right. Thank you, Dr. Martinez. All right. Just another reminder for Q&A. If you've got a question, you can press *3 on your keypad at any time to get into the queue for our Q&A session. Or if you're watching our live stream, you can type your question under the streaming player. So we'll go ahead and kick off some announcements here. We do want to talk about SHEP. So we've got Stephen Dagadakis here to talk a little bit about that.
Great, thank you. This is Stephen, Public Affairs Officer for VA Long Beach. I have a short announcement, but wanted to request your support with completing the SHEP survey. For those of you who are connected online and can see the slides, there is a picture of what one of the SHEP surveys looks like. And I just request if you just keep an eye out for it, you may receive an email or a copy in the mail. But that survey is really important to us. We do truly value your feedback, and we are trying to get as many veterans as possible to complete the survey so we can get a comprehensive picture about what we can do better, what's working, and how we can best serve you. Thank you.
Fantastic. All right, next we've got our Veterans Social Connection. So our next Veterans Social Connection will take place January 30th out at the canteen patio. So please stop on by from 8:30 to 10:30 a.m. We'll have coffee and refreshments, and most importantly, the opportunity to socialize with your fellow veterans and community partners. So come check it out. And next, we've got our VBA Visitor Engagement Reporting application. So this website is one of my favorites. So for those of you who haven't started a claim with the Veterans Benefits Administration, or VBA, that's the benefit side. So anything having to do with money, so pensions, VA home loans, GI Bill, etc., you can visit. I'll go ahead and give you a website here. It's va.my.site.com/VAVERA/S/. Or you can go ahead and Google VA VERA and look for the site with the VA logo. And you can also call 1-800-827-1000. And just a quick reminder, if you didn't catch that information or any other information throughout this town hall, a recording of this town hall will be available on our Facebook, and we'll be posting a wrap-up on social media as well in the coming days. And of course, we want to stay in touch with you. So we want to remind you that you've got multiple ways to stay in touch and watch what we're doing online. You can reach out on any of our social media platforms. We are at VA Long Beach. So we also send out a weekly newsletter via email that goes out every Wednesday and gives you information about what's going on here at VA Long Beach Healthcare System and other good resources in our community. So it's a great way to keep in touch and keep an eye out on what's going on here. All right, and lastly, as Dr. Martinez spoke earlier about suicide prevention, if you are a veteran in crisis or concerned about one, the Veterans Crisis Line is here for you. You don't have to be enrolled in VA benefits or healthcare to call. So dial 988, then press 1, or you can text 838-255. You can also visit veteranscrisisline.net to chat with someone. Again, all these resources, to include emails, websites, and points of contact, will be available on our Facebook and Instagram after the town hall. If you're not online, you can email us at veterantownhall@va.gov to request more information. All right, what everybody is excited about. So let's jump into our Q&A portion of our presentation. Again, if you have a question, you can press *3 on your keypad at any time to get into the queue for our Q&A session. If you are participating online, you can submit your question below the streaming player. All right, let's check out some questions. All right, we've got one for Mr. Emmett O'Meara from Veteran Benefits Administration. let's see here. I know there has been a high volume of veteran interest in scheduling VSO appointments. What options do I have to schedule them? Mr. O'Meara, do we have you online?
Yes, I am here. As far as the VSOs go, they are independent of VA. We certainly work in partnership with them, but we don't control their schedules or how to access them. What I would suggest is, and it was shown earlier here, was the appointment tool that we use here in VBA to schedule an appointment with us if it is something you would like to speak with us about, and we're more than happy to do that. So I'm sorry I can't answer it specific to the VSOs, but at least in terms of getting in contact with us, I would encourage you to use that VERA tool, VERA.
Very nice. Thank you so much. Appreciate that. All right. Our next question is for Dr. Swaroop. What are the plans to speed up blood draw department? Veterans are standing in the hallways and sitting on the floor while waiting over an hour.
Thank you for the question. So we have definitely worked diligently to improve our wait times in the phlebotomy lab. While we're extremely excited about being able to activate the beautiful new space, we recognize with it there was an introduction of new processes. And with those new processes, including the new kiosks that you see when you first enter the lab, there has been an increase in the wait times due to that. So we are actually working with our systems redesign team. This is the team of staff that help us work on process improvements to track the flow, the wait times, and really looking at the process from start to finish to make sure that we have optimal staffing levels as well as processes in place to decrease your wait times and make sure that when you come in, you have a seamless experience. I do also want to emphasize that some of the new steps that have been introduced have been done to improve the quality and the safety of our lab draws. So we have a new labeling process to make sure that when your blood is drawn, we verify it's your blood and that it goes to the lab so that there's no missed specimens and you don't need to come back to get those redrawn. That has added some time to the process, and so we're working on finding ways to make it as efficient as possible. So we really thank you for your patience. We have seen an improvement in the last month, and we expect to continue to see improvements over the coming time.
Thank you. All right, our next question is for Dr. Kramer. Are there any plans to upgrade the phone access to avoid having operator to dial?
Yes, good evening, everyone. I'm Leah Kramer. I'm the Associate Director here at VA Long Beach. And while there are no plans currently to do away with our operator or our call center system, those plans are here to stay. We are always looking to improve our processes. And we do recognize that sometimes the extensions that our operators use can change that access each of the clinics. And so moving forward, we are planning to do an annual audit to ensure the accuracy of our phone extensions so that they are going to the correct clinics. For those who are calling our call center, you will experience that our primary care clinics can be scheduled directly, and then for some of our specialty clinics, they will refer you on to our specialty clinics. You are also able to call our community-based outpatient clinics directly. Those numbers are available online. And additionally, if you just don't want to use our phone system, you are welcome to reach out to your teams via MyHealthyVet. So I do want to encourage you, if you haven't set up a MyHealthyVet account, to use that as well, because that is a really great way to directly reach your clinic and your teams as well. Thank you for the question.
All right, thank you. All right, so our next question is for Dr. Swaroop. Can we see the whole question? Is that where it starts? Okay, so pain medication that the VA does not want to prescribe due to addiction effect. Appointment seems to take 2 weeks or longer. Can he go to an outside appointment for pain management and have the prescription filled at the VA?
So to have prescriptions filled at the VA for any type of medication, it requires a VA Long Beach prescribing provider. If the wait times are long for a specialty appointment, the veteran's provider can, and the veteran is eligible for community care, we can place the referral for the patient to be seen in the community. However, if the community provider recommends a prescription or medication to be ordered, we do need someone at VA Long Beach to actually order that medication, because they will then take responsibility for prescribing the correct dose, reviewing the records, and making sure it's an appropriate medication with no other interactions for that veteran. So the short answer to the question is no, it does require a VA Long Beach provider to order the prescription.
Thank you. All right, another question for Mr. O'Meara from VBA. So VA hearing, as far as the process, why is it taking so long, 3 to 5 years, to have a hearing assigned?
Hello, Emmett again. I believe the hearing you would be speaking about is with the Board of Veterans Appeals, which is separate from VBA. As far as hearings that would be completed by our office, it is not anywhere near that length of time to get a hearing completed. And I say this based on the fact that I have had other complaints and inquiries regarding the length of time it takes for a hearing. And those are always, when they're that long, always associated with the Board of Veterans Appeals. I don't mean to sound like I'm driving a bus over them, but I believe that's where it would be for you. And it's a volume versus staffing issue in a nutshell for the answer. I'm sorry I don't have a more clear answer for you, but that is the most clarity I think I can provide at this time.
Okay, thank you. I appreciate that. Thank you. All right, our next question is for Dr. Kramer. Is there anything that will be done about personnel answering the phone and or leaving a message for, our question disappeared. We'll get it back, hold on. All right, is there anything that will be done about personnel answering the phone and or leaving a message for a callback? This veteran has never received a callback, everything from clinics to transportation.
Yeah, hi, it's Leah Kramer, Associate Director again. So first off, I want to apologize. I'm sorry to hear that this has happened. It is always our very best intention to return the calls that we received, and so to hear that you did not receive a call back, we are sorry for that. Without knowing further about that specific instance, it's hard to know why that may have happened, if perhaps, as I mentioned before, the extension was outdated potentially, or the individual you're reaching was potentially on leave, or it was directed inappropriately. It's hard to say. But what I will say is if that happens to you and you haven't received a call back, please don't just accept that. You are always welcome to file a complaint with our patient advocate office if you're unable to reach the clinic repeatedly, and we will look into the processes and work to improve those processes. We take all of our veteran feedback very seriously. We want to provide you with the best possible care, and if that is repeatedly occurring, please let us know, and we will work to correct the issue. Thank you.
Fantastic, thank you. And just a quick heads up as to where Patient Advocate is located. So they're going to be in Building 165, C108. So there's a welcome desk over there, and you can go ahead and get checked in and talk to our patient advocates. So thank you for that. And what are the hours for patient advocates? All right, 7 to 3:30, Monday through Friday. So head over there. All right, our next question is for, let's see, Mr. Dannenberg. All right, will there ever be a time that we can possibly get health care for our spouse if we're not 100% disabled, even if it requires us to pay?
Yes, that's a great question, and I know in my experience with VA, there are some sites that participate in CHAMP VA, which provides for healthcare services to be provided to family members of our veterans. And I will say with the current efforts underway for VA transformation and organization, that it's very clear that we are putting veterans first, and so that will be first and foremost our priority in providing care and services. With that said, there are opportunities when capacity allows to look at the possibility of providing and extending services and resources to family members of veterans, in particular caregivers, and that might be a great resource or a topic for a future town hall, is the resources and services that are available to our valued caregivers, which typically do sometimes and often are family members of our very own veterans. So that is a great question, and as space and capacity allow, that could be a conversation in the future about expanding services to cover more than just our veterans and family members as well.
Great idea. All right, and then another question for you, sir. Is there going to be a system in place to prevent Cal State Long Beach students from parking at the VA?
Yes, parking is an incredible opportunity for us, and you heard Mr. Strelitz, our chief engineer, talk about the new parking structure that is hoping to come online here in the summer, and really looking forward to expanding the parking capacity. But until then, parking spots are at a premium, and there are often times where we are in close proximity to Cal State Long Beach, and we have students that take advantage and take up spots that our employees and our veterans could better use for health care and services here at the VA Long Beach healthcare system. We do actively work with our VA police to patrol the parking lots, and we do have a limited number of police officers that are here 24/7, but there are many more eyes and ears of our employees and our veterans who are coming onto campus every single day, thousands of individuals, thousands of pairs of eyes. So if you do happen to see someone that does not belong on the VA Long Beach healthcare system taking up a valued parking space, please do take note of that, the description of the car, maybe even a license plate, and report that to preferably a VA police officer or a staff member, so that we can convey that and follow up and ensure that we make the appropriate actions for anyone who is not parking on the campus legally.
Thank you. All right, our next question is for Dr. Vo, Chief of Primary Care. Why does the primary or special doctors not provide a nexus letter or a DBQ questionnaire to be filled out when requested for claims, especially when the doctor is part of the VA and knows what's going on with the veteran situation?
Hi, thank you for the question, and I just want to clarify, what is the nexus letter and what the DBQ questionnaire is. The nexus letter is a letter that will establish causality of the current medical condition if it is connected to a past event. So for a primary care provider or a specialist, we do not have the information what happened in the past to really make that connection. And in fact, there is a VHA directive recommend that primary care provider or VHA healthcare provider not to provide the nexus letter, because we just don't have enough information to help the VBA, the Veterans Benefits Office, to adjudicate, the condition. With regarding to the DBQ, there is a certain DBQ that can be complete by the primary care provider, but there are many DBQ that require a specialist with CNP training, compensation, and what's the P stand for? Pension training, and they have to be a certified CNP provider to be able to complete those DBQ. So when in doubt, contact your VSO and get the case adjudicated to a VBA office so that it can be assigned to a certified CNP provider to help you, with that nexus letter or the DBQ. Thank you.
All right, thank you. All right. Next question is for Dr. Swaroop. When is the VA going to bring new technology as far as stem cells? Neuropathy problem, they state maybe stem cells will help, but the VA does not have the technology.
Yeah, so great question. Nationally, the VA does have a few centers that offer stem cell technology. I believe Nashville is the first and only center currently in the VHA that does have stem cell transplants being offered. It is a very resource-intensive program to be able to start that requires quite a bit of expertise, staff, and space. So it is not easy to get initiated at a medical center. So most VAs rely on community, especially our academic affiliate programs, to be able to offer those resources. The VA has also started research in stem cell, especially in new therapies, as you mentioned, and so there are sites in the VA that are offering research opportunities in stem cell. So we imagine in the future it'll be a growing opportunity for us to introduce across the country.
Thank you. All right, our next question is for Mr. Strelitz. When are you going to make it easier to get to the MRI or CT scanning area? It's very hard for some of us to go all the way around to an office that's just across the main clinic and ER area.
At this particular moment, there is no specific plan for access across that courtyard, but that is something that we can take offline and discuss with the leadership on how we might be able to implement that. At this particular moment, the long-term plan is that we will be expanding our ED, and that project will include a interior corridor that connects the back or the north end of Building 164 to the corridor where the MRI and the oncology centers are. That's the current plan. Thank you very much.
Yeah, and this is Walt Dannenberg, Medical Center Director. I would add to that do appreciate the lengthy walk that it does take to currently access that area. With that said, we do have a team of transporters and volunteers and offer shuttle services that may make it easier for you to get from point A to point B, not just to the MRI area, but also anywhere on campus as well.
All right. And Mr. Dannenberg, another question. What is the VA doing to address the short staff issue in all the clinics, and when will they begin hiring more people?
Yeah, so that's a really good question. I know there's a thought of VA being short-staffed, and I will share with you that when VA underwent the efforts to reorg, which were currently underway, there was a strong push to allow us to be able to recruit physicians that provide direct care to our veterans, and we were successful in being able to obtain approval for recruitment of physicians that provide direct patient care. And as we, again, go through the organization and restructuring, there is a need to pause and ensure that we have a correct accounting of all of our physician and physician numbers, and I know it's getting a little bit into the weeds. But there is discussion happening at my level as well as VA Central Office with regards to being able to move forward and unfreeze positions and being able to recruit for all of our positions across the healthcare system and not just the direct patient care positions. And I expect that to hopefully be within the next several weeks, so to be able to make some headway there.
All right, thank you. All right, next one is for Dr. Swaroop. It's hard to get an appointment, and follow-up takes days or weeks. By the time he gets an appointment, it is worse and he has to go to the ER.
Thanks for the question, and I'm sorry to hear that's been the experience for some of our veterans. We always want to make sure we're providing timely care and appropriate care whenever it's needed, and we definitely want to avoid and decrease the amount of time spent in the emergency room. We definitely encourage the use of our veterans to utilize My Healthy Vet. It is a great way to be able to contact your primary care team. You're able to access the full team, send a message, and make sure that we're able to hear the concerns, see what symptoms are happening, and get you to the right appointment or the right evaluation in a timely manner. So we are actively working on improving our wait times and our access to clinic appointments, but regardless of what's going on, if it's not clear or you don't have an appointment coming up, please make sure to message your primary care team in My Healthy Vet.
All right, thank you. All right, next question is for Mr. Strelitz. What about homeless and destitute veteran services? Any projects to improve upon or expand space? Lastly, where can the proposals regarding all current and future projects be found online? I would like to track information real time.
Okay, so the first portion of it, talking about homeless and destitute veteran services, I will provide that. That really needs to be answered by our clinical leadership, and our Chief of Nursing Services, Dr. Maynor, will be able to provide some more information for the Resource Center. When it comes to the projects themselves, at this particular time, we don't have any specific projects to expanding space for homeless capabilities, but we have recently moved our social services and increased the sizes of those organizational spaces to provide better care for our veterans. When it comes to the online capability of providing real-time project, we don't provide that, in that it's an inordinate amount of information that can't be provided as it's an ongoing project. However, what we do provide online is a summary which we update on a regular basis on the current status of the project, and can provide that. If there's more information, detailed information that's needed, be more than happy to, through the request for information process, to take that information and be able to provide that information back.
Awesome. Thank you.
Thank you.
All right, our next question is for, sorry, yeah, we're doing the first part of this question as far as the clinical side of it.
Hi there. Thank you for your question. I'm Charmaine Maynard, the Acting Associate Director for Patient Care Services. And just regarding the resource for our veterans experiencing homelessness, or who perhaps need additional resources, you can always walk into our medical center and visit our Veterans Resource Center and talk with a social worker who can get you set up with the resources you require. They are available Monday through Friday, 8 a.m. to 3:30. And after hours, there is a national call center for homeless veterans that you can contact, and they will also set up assistance for you. That phone number is 877-424-3838.
All right, thank you.
Thank you.
And this is Stephen Dagadakis, Public Affairs Officer. Although we don't have minute-by-minute updates, I do encourage you to follow us on social media. We're on Facebook, Instagram, and X, as well as have a weekly newsletter, and we regularly provide updates about the status of our major construction projects.
All right, thank you. All right, next question from Mr. Dannenberg. VA app suggestion. Is it possible to add department attending for that day? Just shows building and room number, not specialty.
Yes, if I understand the question, I think this is regards to our appointment notifications and appointment letters, and I know VA is working diligently to standardize that and to add actual location versus more information with regards to what specific clinic the appointment is versus just name, or a name, location, and room number. So that is something we are working on.
All right, sounds good. All right, and we've got our next question for Dr. Pallid. Will there be continue group for relaxation and meditation with Dr. John Juan?
Wong.
Okay, Wong. Okay, doctor.
Hello, I'm Dr. Pallid. That is a great question. He is a very, very good clinician, and that group is ending, but we do have other offerings when it comes to relaxation and meditation, starting from whole health all the way to our mental health department. So I would suggest that if you are looking for more of that kind of services, to reach out to your either primary care provider, or if you are in a BHIP program or one of our specialty mental health programs, to reach out to them, and we will connect you to the right service.
What does BHIP stand for, Dr. Pallid?
Behavioral Health Interdisciplinary Program, which is our regular outpatient program.
Awesome, thank you. All right, next question, also for you, Dr. Pallid. With so many veterans at risk for mental health problems, has been removed from Texas for a situation, was offered to come to Long Beach, working with doctors. What kind of protections are out there for abused veterans?
This seems very specific, situational, so I wouldn't want to just give very specific answers to this. If you are looking for services or needing same-day access, we have our UMHC in Building 800 for you to walk into and reach out for mental health services.
All right, thank you. All right. Our next question coming up here. So Dr. Vo, so we spoke about operational consistency, had an issue. It didn't schedule his blood work before appointment. The Santa Ana Clinic does not take walk-ins, came in and didn't get his blood work done.
Hi, again, this is Dr. Vo. The CBOX, the community clinic, usually do the blood drawn based on the appointment because it is not the lab area per se. The reason for that is that the staff need to prepare. They have to verify the order and get all the lab equipment ready. So that is why it requires an appointment and not a walk-in.
All right.
Thank you.
Thank you. And I'll go ahead and take this next one. The question was, what is the date of the next VA Social Connection or Veteran Social Connection? That will be Friday, January 30th at the Canteen Patio, and that's behind Building 165. It'll be from 8:30 a.m. to 10:30 a.m. And just for situational awareness, those are every last Friday of the month with the exception of, I believe, November and December. As those are holidays, and but come out January 30th. We hope to see you there. All right, our next question is for Ms. Clement, Ms. Chastity Clement. This question is, dissatisfied with mental health provider, what can the veteran do?
Hi, good evening. Thank you for the question. Anytime a veteran is dissatisfied with their care or at an impasse, you're welcome to contact the Patient Advocate Office. We can be reached at 562-826-5467. We are also available via secure messaging by selecting the Patient Advocate Office under the triage team. We also welcome compliments and suggestions, as I've seen some of you have asked here. So please reach out to us if you have any questions about the care you're receiving or services we offer.
All right, sounds good. Thank you. All right, next question is for Mr. Strelitz. I read that EV charging has been eliminated from the budget. Does that mean that we will not have charging stations at the VA?
So that is not true. We will be having EV charging, but there's some caveats to that. One, when they say that the EV charging was eliminated, what it's doing is the VA has taken away the earmarking of funds that were specifically just for sustainable projects and put it back into our non-reoccurring maintenance budget to build projects. We are still mandated and required by executive order and by congressional requirements to reduce our environmental footprint, and that includes sustainable situations like putting EV systems in. So we incorporate it now, and we've always been doing it, incorporate the EV chargers into the projects themselves as a subcategory. And in our garage, we will have EV for government for government vehicles. Unfortunately, right now, for personal owned vehicles, we don't have specific guidance from the agency on how to implement that, and we're still waiting for it. As soon as we get that, we will then be looking at how we can implement that onto campus. Thank you very much.
Okay, thank you.
Yeah, I think there's a...
Oh, yeah, we've got another one. Will there be improved assistance for the disabled in the new parking?
So right now, the garage will be 30 ADA compliant parking spaces for handicapped veterans and visitors, as well as staff. We also have on campus already our shuttle service. That shuttle service provides a fixed shuttle that has a wheelchair capability to bring patients around the campus, picking them up at various shuttle points, as well as a courtesy shuttle that can be called upon. There are signs across the campus that have the phone number and the particular station number that the courtesy shuttle can be called and to the person and pick you up at that point and take you to wherever you need to go. Those are the exterior outside the building capabilities that we have for transportation as well as parking. And of course, the main parking for handicap is in the front of the building for visitors and patients, and we have 10% of the parking there, which is very high is devoted to ADA-compliant parking. Thank you.
Thank you. All right, another question for Dr. Pallad. Just came out of 2 hospital stays. Will there be better facilities for recovery for mentally disturbed vets?
Hello, this is Dr. Pallad. So this is, again, quite specific. I would encourage that if you are connected to one of our mental health services, to reach out to your provider, whether it's through secure messaging or walk into our UMHC clinic in Building 800 to receive your services and get connected. I also have Dr. Audrey Martinez here to kind of share about some resources through suicide prevention program.
So when you discharge from a hospital, we do have efforts to try to work with facilities as best we can to identify veterans who are discharging from community facilities. And we have a transitions discharge clinic. However, if you're not connected with care and your hospital is not able to connect with VA Long Beach, you're also able to come into urgent mental health clinic to be seen same day by a provider. Really what you want to do is get in touch with a provider, get you integrated into our mental health system, so that way we can help with care coordination and getting you set up with appropriate outpatient programming. We have MICM, we have mental health intensive case management, we have PRC, which is a outpatient program that helps veterans who are coping with schizophrenia, delusional disorders, and different conditions like that. We also have connection with community providers to help provide maybe intensive outpatient programming. But again, you would really need to speak to a provider to get a deeper dive as to like what's most appropriate for your situation. So again, I would encourage you to just keep calling the overall triage line. If you're not connected with a provider, I would say come into UMHC to get connected.
And UMHC is?
Urgent Mental Health Clinic.
All right, perfect, thank you.
In Building 800.
There you go. All right. We have one other for you, Dr. Pallad. Why are they canceling all the mental health groups that have been in session for a long time?
So our psychotherapy services are time-limited, evidence-based treatment, and that also goes in line with our group therapy offerings. We do have a few groups that have been long-standing, and so those are the ones that are not necessarily aligned to this type of treatment that we're providing here at the VA. With that in mind, if you are needing more services for mental health, they will be offering you kind of a treatment planning session if needed, so that we can then connect you to the right type of treatment that you're needing.
Perfect. Thank you. All right. Our last question here. What is the VA stance on medical marijuana?
All right. So this is Walt Dannenberg, Medical Center Director, so I'll go ahead and take that one. And I know that is a topic that often comes up. And as it stands now, marijuana is a banned substance on federal property. And I know that marijuana is used in the community, and I know there has also been some recent news about changing the classification of how the federal government classifies marijuana. But until that changes and VA offers guidance as it stands now, and until that changes, that marijuana, even medical marijuana, is not considered, or is considered a banned substance.
All right. All right, well, we really appreciate all of the questions that we have received. If we didn't address your question, know that we'll be routing them appropriately. We do appreciate the opportunity to speak directly with our veterans and answer your questions. So we're looking forward to hearing from you in the future and keeping you informed on what we're working on and other important updates. So we've got some contact information. I'm not sure if it's going to pop up here. Oh, it does. Okay, so you can ask us your questions by sending us an email at VHALON veterantownhall@va.gov. Thank you all, and thank you for your service. Stay safe out there.